So, Dr. McDougall, you've written about working with native populations, and that's kind of where you got your the epiphany that eating a starch-based diet was this traditional diet from all these different populations was really the natural way of eating. And Dr. Nagra was just talking about how there's a genetic component to Alzheimer's. Were you seeing Alzheimer's in people who were eating that traditional diet?
No, but I wouldn't rely on the amount of observation I had
Okay.
back 50 years ago. So genetics is always an issue, in every disease, smoking, heart attacks, weight gain. It's always an issue, your family makeup. So I can't control that. Patients can't change their genes. We have to talk about something we can do something about, like the aluminum or the high fat, high cholesterol Western diet. Yeah, I had a chance to study rural populations, native populations. That's why some of you probably recognize my background here. It has to do with the time I spent in Hawaii back between 1972 and, well, the most important time was between 72 and, actually it was 73 and 76. I was a sugar plantation doctor on the Big Island of Hawaii. I had 5,000 patients I took care of. I did everything. I caught their babies. I did brain surgery. I pushed pills. I was a regular old doctor back then, and I had two observations, which I'd like to share with you if I have a minute. One is I was a lousy doctor. My patients did terrible when I practiced medicine of drugs and devices. They never got better. And I knew they should get better because I came up from a time of Dr. Welby, Ben Casey, and Dr. Kildare, Marcus Welby. Okay, that was my day. I knew what miracle doctors did. I wasn't doing that. My patients never got well. Well, when I sewed up lacerations or set broken bones, they were pleased, but in general, not. So that's the first thing I learned. The second thing I learned was from my patients directly, and that is I was taking care of first, second, third, and fourth generation Filipinos, Japanese, Chinese, and Koreans. First generation means they were raised in Japan or the Philippines on a diet of rice and vegetables. They moved to Hawaii, started the second generation. They had kids, and they became influenced by Western civilization. We had up from our sugar plantation in Honokaa, we had Texas Drive-In, the home of the malasada. They really got enthused with the Western diet. And the third generation fully westernized. In fact, maybe worse, because they're some of the most unhealthy people around, the citizens of Hawaii. So right in front of me, I had a contrast of people who were extremely well, never overweight, never with heart disease or strokes or rheumatoid arthritis or multiple, never, ever. And I had their offspring, same kind of work, same genetics. The only difference was in the food. So my patients taught me, first of all, my shortcomings, and second of all, what the problem is and what the solution is.
Thank you. I got a question for you, Chef AJ, a little bit of a different topic. So, Dr. McDougall talks a lot about potatoes and starches, and during your cooking demo earlier today, you talked about your favorite food, your lunch. Can you tell us a little bit about that and a great way to prepare it?
Absolutely. Well, for 12 years now, every day I ate the same lunch. It's a hana yam, which is my favorite kind of sweet potato. It's not orange. It's kind of beige. You can't get them everywhere, but most places, if you look in ethnic markets, they could be called a hana yam, a Jersey sweet potato, a white sweet potato. They're more like a Yukon Gold than they are a sweet potato. They're not mushy like the orange ones, which I don't really care for. And they're just delicious. And I eat about 1.5 pounds of them. That's the weight. I don't weigh and measure my food. I look for the biggest one the store sells, which is usually about 2 pounds. And after I roast it for 90 minutes, it's about 1.5 pounds. And it's just so delicious. And I eat it with broccoli because it's kind of sweet. And I have 1 pound of broccoli, and it's like so filling and it's so delicious. And when I have to travel to Mexico, which I do frequently for a job, and I can't get them, I'm eating other starches like rice and other kinds of potatoes and millet. And I love sweet potatoes. Dr. McDougall once said you could live on sweet potatoes and broccoli, and I took it seriously because it is my favorite food. And I think if I was going to be executed for a crime I probably didn't commit, that would be my last meal because it's so good. But you got to roast them. Don't steam them. You got to roast your sweet potatoes. When you microwave them or steam them, they're mushy and they don't have the sweetness and the caramelization. But yeah, sweet potatoes is I just love them so much.
And how would you prepare that? What would be a simple way for?
So Chef Bravo at True North taught me the easiest way, because I used to sit there and wash them and poke them. And when you poke them, sometimes it oozes out and it messes up whatever you're cooking them on. You just cut the tip off just very gently on both ends, and then the steam can escape without messing up your oven the way you do. I don't know where people started poking them, because when you poke them, it just oozes everywhere. 90 minutes at 400, but remember, I'm cooking very, very large ones, and they last about a week in the fridge. So I have my lunch for a week, and I pull it out. The thing is I have a dog that loves them too, and we fight for them. It's crazy.
And now a lot of people wrap their potato in aluminum foil.
I never understood that.
You want to do.
No, I never use foil. I hear it's not good for you. If you do use foil, you got to wrap it in parchment paper first, because aluminum's not good for you. So I don't know where that came from. I know restaurants do that, But
so how do you just put it on a pan in the oven?
I use something called, it's like a nonstick silicone baking pan, because it's just easier to clean. And if I use parchment paper, then I have to keep using another piece, which isn't great. I could run and get it if you want, but it's basically, it's called a Silpat, or a nonstick silicone baking mat, which is oven safe to 550 degrees. And that's what I use. And I use it over and over and over again.
Okay, thank you. I'm definitely going to try that out. So, Dr. Nagra, do people eating a low-fat, whole food, plant-based diet get heart disease and cancer and all these things? And what kind of rates do you see? Alzheimer's, all the stuff that we've been talking about. Do they? What kind of rates do you see of the top killers with people who are eating the plant-based diet?
So we do have. I would say we have data on people eating plant-based diets in general. We don't have solid data on long-term follow-ups of people eating exactly the way that you're describing now. If we look at a meta-analysis from 2017, and they're separated into, vegans, vegetarians, and meat eaters, you see that vegans have about a 15% lower risk of developing cancer compared to meat eaters. But again, this is vegans as a umbrella. So people eating strictly plant-based diets, not necessarily what you're talking about. And we do have a lot of data on, again, those healthier plant-based foods and their association with risk as well, suggesting that, hey, maybe if you're eating more on the whole food side, you'd be even lower risk. As far as, do they get these diseases at all? Yeah, it can still happen. A lot of people adopt these dietary patterns late down the road once they've already developed, disease to a degree. And so at that point, it's a lot harder to fix the problem, but you can certainly slow down the progression and hopefully stop the progression. But I wouldn't be super confident in saying it's like 100% guarantee or anything, because nothing really is. There's always going to be risk there. It's about modifying the equation, lowering the risk as much as possible, doing what we can to control the risk factors that we can, like we've talked about genetics and things as well. So I can't give you an exact number for what you're asking about, just because we don't have that data, really.
And Dr. McDougall, I'll ask you about your own diet, the starch solution type of diet. What kind of health results do you see out of that?
We've published our results. We published our results showing what happens in 7 days, and I have 2 independent studies showing what happens in a year. One done by Oregon Health and Science University. So we have them. The result is in 7 days, people drop their cholesterol 22 milligrams per deciliter. In 7 days, people with high blood pressure, those 140/90 or greater, and most are on medication, they drop their blood pressure 18/11 millimeters of mercury in 7 days. And by the way, nearly 90% of people get off or reduce their medications during that 7-day period of time. So we have published results on insulin levels, on fatigue levels, all kinds of things. So I'd like to point out, again, not in any disagreement, the studies done on vegetarians, vegans, et cetera, show similar results to what we just talked about. But and that's why I don't teach a vegan or vegetarian diet. What I teach is a diet of starch-based, because we've got thousands of papers studying disease incidence in various countries in various times. Like, for example, research published in China. Before 1980, in China, obesity, type 2 diabetes were virtually unknown on a diet of 90% starch. In 2013, when I first ran across the recent data, and they got even more recent data, in China, 12% of the population are frankly diabetic and half are pre-diabetic. That's what happened in 40 years when they gave up the starch-based diet. So we've got data on Japan. For example, after World War II in Japan, there was virtually no breast cancer or prostate cancer. You could count it on a few handfuls of fingers, the number of cases that they can find in the entire country of Japan on breast and prostate cancer. And you look at the African work. I've studied research out of Africa for my whole career. And you find the same thing. In rural Africa, these diseases do not exist. Are they vegan? Probably not. If a pork chop ended up on the Sunday dinner table, they'd probably eat it. Are they starch eaters? Yes, they are. So, that's why I've got away from the terminologies, whole food starch-based diet, vegetarian diet, vegan diet. Not that they aren't proper descriptions. They're just not descriptive enough. Descriptive enough is you eat the bulk of the calories from starch, and then you eat some fruit and some green vegetables, and we serve no animal foods. Mary and I eat no animal foods. But would I tell somebody that they couldn't have a piece of turkey on Thanksgiving, et cetera, only from a religious point of view or a concern for the planet or animal rights, which are really valid. In fact, issues I spend more of my time on than health these days. They're really important issues, but you don't have to be a vegan, except for one thing. I want to throw in one caveat, is you really have to be, because you can't do a little bit. And that's the problem with the patients we're taking care of, is they have been raised on the Western diet. They're used to it. They, quote, love it. They don't know any better. They're raised on the Western diet. And as a result, they're habituated, strongly habituated. Some people use the word addiction. And so for them, just like for other people with one cigarette, if they're tobacco addicts, and one drink if you're an alcoholic, you know what happens? Some of these people out there, it's, one slice of cheesecake and they're down every buffet in town. They can't stop. So it's much easier to be vegan, 100% or 100% oil-free, than it is to do exactly what I told you, which is a starch-based diet with giving you a little latitude. You take that latitude and you're off for trouble, is all I can say.
Yeah, and then I'd agree with you too, as far as you don't necessarily need to be 100% in order to reap the health benefits. Like you said, once special occasion, Thanksgiving, whatever, isn't necessarily going to affect everything, but it could be a slippery slope for a lot of people. And certainly as far as you look at certain populations, rural China, rural Africa, and they tend to have lower rates of these diseases. I prefer to look at data within a population, just because then you're controlling for other variables, right? If we compare rates in China to America, well, there are so many differences. It's not just diet. There are tons of differences between those populations. And when we look at these sort of country to country comparisons, actually, countries with the highest meat consumption have the highest life expectancy. In fact, countries with the highest cigarette consumption per capita have the highest life expectancy. But we know that when you look at a defined population, those who smoke more have higher risk. So is it smoking leading to greater life expectancy? No, it's the fact that those people typically are of higher affluence, greater socioeconomic status, and that's a huge predictor as well. So I tend to favor those within population comparisons for a bit greater internal validity in the statistics.
All the information is of value, and I do look at studies done on just one population of people. I'm very familiar with that literature, but for me, it just makes the picture a lot more clear. Just like I told you the story about my plantation days on the sugar plantation. My first generation patients never had these problems. Second, third, and fourth, they're fat and sick. That's more of an interpopulation study than you've ever seen. It was my patients.